When you first land on the Cleveland Clinic website, the design is modern and clean, with a white and blue color palette that gives a clinical yet user-friendly impression. The top navigation bar is packed with options, from patient care to locations, appointments, and access to the MyChart login. It's immediately clear the site is designed for quick access to healthcare services, especially for returning patients. Hovering over each section reveals drop-down menus with more targeted options, such as Find a Doctor, Pay Your Bill, and Virtual Visits. These are neatly organized, but may feel overwhelming for first-time users due to the sheer volume of links. One of the first things I tested was the appointment scheduling feature. The platform allows you to search by provider name, specialty, or condition. The filtering system is helpful, but a bit sluggish on mobile. Once you find your provider, appointment availability is displayed in real time, but in some cases, especially with specialists, slots can be limited to weeks in advance. The ability to schedule both in-person and virtual appointments is a strong feature, but the process can be inconsistent depending on the department. I also explored the MyChart patient portal. Accessing it requires creating an account or logging in, which includes two-factor authentication for added security. Inside, you can view test results, send messages to your care team, and manage prescriptions. The interface is intuitive, but occasionally slow, especially when accessing large documents or message threads. The integration with Cleveland Clinic's system is thorough, but expect some delays in updates for lab results or imaging. The virtual visit feature is another major focus. It works through a separate login and requires setting up a pre-visit test. The interface is functional, but could use design improvements. Audio and video quality depend heavily on your connection, and not all departments offer virtual visits, which can be frustrating. In some test cases, customer support was difficult to reach, and chat responses felt automated or generic. Another section worth noting is their medical library and health education tools. There's a massive amount of information available, from conditions and treatments to wellness tips. However, the content is text-heavy, and some articles haven't been updated recently. It's a useful feature for self-education, but doesn't replace actual consultations. Billing and insurance information is easy to find, and they offer a cost estimator tool, which can help you get a general idea of potential charges, though it's based on average costs and not always precise. Paying bills online is straightforward, and you can also set up payment plans if necessary. In terms of accessibility, the site supports screen readers and font adjustments, but more could be done for visual impairments. The mobile version is functional but cluttered, and some drop-downs do not scale properly. Despite these issues, the Cleveland Clinic site remains one of the more comprehensive healthcare platforms available, especially for those already in their system. If you're thinking about using Cleveland Clinic services or are already a patient, the website is a powerful resource, but be prepared to navigate some inconsistencies and occasional usability hiccups. Whether you're booking appointments, managing your health records, or trying to learn more about a diagnosis, it gets the job done, though without room for improvement. If you found this review helpful, don't forget to like the video and subscribe for more honest tech and service reviews.